Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on Wednesday, July the 26th. Pleasure to have you with us today. We're going to talk about a very important and serious subject on our segment today, and that is suicide. I want to introduce you to Carisa Kessler. You are the Director of Crisis Service at Burrell Behavioral Center here in Columbia. So what does it mean to be the Director of Crisis Service?
Good morning. Thank you for having me.
Oh, you're welcome.
Yeah. So when you think about our crisis services at Burrell, you can kind of think about an umbrella, and under that umbrella would be multiple programs. Each program serves a different population. And so with that, we are able to connect with many different individuals in the community, as well as collaborate with law enforcement, the courts, maybe other community partners.
You deal with suicide?
We do deal with suicidal individuals, yes.
Now, you've got a 988 number. Mm-hmm. Is that a crisis number for suicide, or is it a crisis number for any problem?
Good question. So it is a 3-digit crisis hotline number. So when we think about crisis, that is very self-defined. And so it could be anyone who is in any sort of distress, whether it be contemplating suicide or maybe housing insecurity. So whatever is causing you distress at that moment, when someone calls 988, they are going to reach a very well-trained crisis specialist who will help them navigate that distress and provide them resources and access to different information.
Is this ringing in to Burrell?
Yes.
So it's local?
So Burrell is part of the national network of certified call centers. So when someone calls 988, that call will be routed based on their area code and prefix.
Now, you mentioned besides suicide, because you can call this if you are contemplating or if you know someone who is contemplating suicide.
Exactly. So you can call on behalf of someone.
So
yes.
What's going to happen? Let's say, because we were talking about suicide on another segment, mm-hmm. Let's say you have the suspicion that someone you know or someone you love is contemplating suicide. Mm-hmm. You call this 988 number. What are they going to tell you?
So when you call 988, you will get a couple of options first. So if you press 1, that is going to connect you to a veteran crisis line. If you press 2, that will connect you to a Spanish-speaking crisis specialist. 3 is our gender-affirming crisis specialist. And then if you wait past that greeting, you will be connected to the certified crisis line in your area. And so really, if you are the individual, we're going to ask about safety. And, depending on that current situation, then we are going to provide the resources and the assistance. Sometimes that means engaging other community partners as well. If you're calling on behalf of someone, it really can look the same. We will provide that individual, the best practices and the resources to help get the person that they're calling on behalf of assistance.
How long does all of this take? I mean, if you're in a crisis situation, someone who is contemplating suicide, mm-hmm. is this going to jump into place within a matter of minutes?
Yes. So the first questions we will usually ask is about safety, looking at have they already done something? Because if an act has already been completed, then, that call is going a different direction. We are calling for medical assistance to help that individual. Depending on, the other questions or responses, sometimes we're able to help resolve that crisis, we're linking them to other maybe programs even within Burrell or other community programs as well.
Yeah. You mentioned housing insecurity. Do you have calls for people who call about this?
Sure.
And how are you handling that?
It will vary person to person. It's hard to say we will handle a housing call this way because it really does
You have to
vary.
delve into it.
Absolutely.
Yeah.
And we have to make sure we're addressing the true needs of that individual. Like I said, it's self-defined.
Right.
And so, yeah.
What do you see as a future for the 988? Do you see it branching out in more directions?
Sure. So really right now, 988 is kind of the front door of what we're looking at for Missouri's crisis continuum. So we have, kind of what we call someone to call. So that's going to be our 988 call centers. And then when we look at the next piece, maybe someone to go. So our mobile crisis response team. And then some place to go. So we have our behavioral crisis centers. So that's the big picture of what we're looking at in Missouri as our crisis continuum, are those three pieces.
How many calls do you get on an average?
So on an average, when we look, since 988 started about a year ago, our calls
it's about a year old down there?
Yeah, it started in July of 22. So
it's just exactly
now,
1 year. Yeah.
Yep.
How many calls have you handled over that year period?
So I can kind of break it out by month. We average about 2,400 to 2,600 calls a month to our
2,400 to 2,600?
So that will come in through 988 or our crisis hotline. Now,
2,600 calls a month?
Yes.
That's a lot of calls.
That is a lot of calls, and about a fifth of them will come in to us through 988. So, like you said, that is a lot of calls. Through, at Burrell, we are very proud of the staff and the calls that we make. We average about a 97 to 98% answer rate with all of the calls that come into our center.
Do you follow up on the people that you have assisted to see how they are doing?
We do. So we have dedicated crisis staff who will follow up with each individual within the next business day. Sometimes they need additional support, or sometimes they've gotten, what they need. Okay,
so that number is 98. Well, actually, you can go to the website, Missouri, spell out the word Missouri, 988.org, and that will give you all the information. But if you are in a crisis, you can call 988.
Yes.
And someone will answer that phone and talk to you.
And you can also text 988.
Oh, you can text 988 too?
You can call and text and chat. Yes,
okay.
So there are multiple options to reach 988.
You want more information, you can check out the Burrell Health Center also, the website.
BurrellCenter.com.
Got it. Thank you.
Yes, thank you.